My name is Michele and I manage the mental health and money advice service within MoneyWise. We're a telephone-based service. Our aim is to help those who are vulnerable with the complexities of welfare benefits, debt or financial difficulties that they have, and their mental health. I work with a team of advisors, and our goal ultimately is to put those people in a better place. For me, the wise move for the project was really being a telephone service prior to COVID hitting. We had the facilities in place for working from home. We had the technology, we had the needs that we needed, the GDPR, the confidential ways of keeping materials. So that was all in place before COVID hit. And it meant that at a time when people were really unsure of what was happening and where to turn, we were there to be able to help them. Our main objectives is trying to dissolve the stigma of mental health and the feelings of stigma that are around debt and people not wanting to talk about them. So for us, the perfect scenario for us would be to bring those people into a place where they feel safe, they feel protected, they feel that they're getting the right advice, they are given the knowledge that what they're being told is correct and this is what will happen. Because sometimes the reason people bury their heads is because they're thinking of a worst case scenario that might never happen. The first thing people think about is courts and ultimately prisons. But there's an awful lot of things that's not true, and the facts do put people back in control. We want our clients to feel protected. We want to give them a holistic approach to the advice, make sure they get good advice, they understand the advice that they're getting, and not let go of them until they're ready to go forward in a fit enough state of mind with what they need to do.
Well, I'd been unwell for quite a while, and things had just sort of spiraled out of control. And I got referred to a CPN, psychiatrist and stuff. My CPN basically had a list of things she thought might help. One of them was taking the pressure off me, money-wise, debt and stuff. So she referred me on to MoneyWise. I got speaking to Nuala, and Nuala and me were in contact just the whole time. It was always just the one advisor, which made it a lot easier then, that you were just speaking to the one person. And if I needed anything at all or needed to know anything, I just contacted Nuala. She was great. Being unwell, it can happen to anybody at any time. So definitely by all the debts piling up and getting help, that was definitely a weight off my shoulders. Whenever she contacted me to tell me that the matters had been resolved, we'd actually got somewhere, I felt such a relief.
To put people's minds at ease, anything that they tell us is confidential. Our clients are vulnerable, they have histories of maybe what has happened to them in the past, and we do our best to provide that confidential place of safety where they can speak to us in confidence and knowing that we're not going to do them any harm.
Well, I was an emotional wreck. I couldn't cope. I was crying. I basically just wanted to get into bed and not get out of it. I didn't really want to live. In my way of thinking was that if I did get the loan, I would pay the person back that I got it off, and then it wouldn't be 3 people I was paying, it would only be the one lump sum. But when all my money was took out, I had about £5 left. I didn't know what to do, and having so little money left and where I was going to get the next pound from, I didn't know where to turn. I just couldn't deal with it, and I wish I had have met you sooner or got in contact with you sooner.
They will deal with no one else. They will deal just with that advisor. So we have one advisor to one client right through that client journey. And well, we're quite unique because there isn't anyone else doing that. Our advisors are qualified in debt, mental health and benefits. So they have the experience and the qualifications to do holistic advice and support with the client. And we will spend whatever time is needed until they're in a place where we feel that we've done what we can, they've taken on board what's needed to be done, and ultimately the best possible outcome for us is that we're leaving that person in a better place.
If you do need help, get in touch with Michele or anybody from MoneyWise. Don't think twice about doing it. They're there to help and they're fantastic.
I do feel like a lot of people are maybe embarrassed or ashamed to go and seek help if they're in debt, but you should never be, because it can happen to anybody at any time, and just knowing that there's someone there that can help you to ease that bit of pressure, for me it was the best thing I done, yeah.
What I like to say is that if you or someone you care for needs help with money, debt or benefits, please call our mental health and money advice service on our free phone number 0808 80 10 373 and choose Northern Ireland. Please get in touch with us. We can help you.